Hey guys, welcome back to another episode of Two Nobodies Talking podcast. My name is Will. I'm here with Nick and Eric, and we are so incredibly happy to welcome our guest today, Dr. Andrew Rothschild, who, if you're watching the video, is down below us here. And we just want to thank Andrew so much for being here. Dr. Andrew Rothschild is a physical therapist who works out of the Virginia Center for Spine and Sports Therapy located in the state of Virginia. He also is a regular blogger at themanualtherapist.com, and he co-hosts an incredible podcast, Healthcare Disruption, with Jerry Durham. Andrew, as you prefer to be called, do you mind if you give us a little bit more about your background, fill our audience in a little bit about who you are if they're not sure or haven't heard of you before?
Sure. Well, thank you so much first of all for having me on. It's definitely an honor to be a guest here. I graduated from PT school in 2006 from Virginia Commonwealth University in Richmond, Virginia. And about 4 or 5 years after graduating, I realized I was struggling and did not know a lot still. And I had
that happens.
I had the opportunity to take part in a year-long manual therapy certification through the Ola Grimsby Institute through a company I was working for at the time. And that was really my first exposure to a formal training in manual therapy. And based on that experience, I continued with a residency and a fellowship, both through the Ola Grimsby Institute, and became a member of the Fellow of the American Academy of Orthopedic Manual Physical Therapy in 2012. And that's basically my education background, other than some advanced training in spine manipulation and dry needling and pain science and good things like that.
Yeah, just a dozen or so specialties. That's all. That's awesome. I also found out that did you play college soccer for a little bit? Is that right?
I did. I played 2 years at Mary Washington College in Fredericksburg, Virginia.
Oh man, did you play offense or defense?
I was a goalkeeper.
Oh man, okay.
And playing is a generous description. It was sitting the bench mostly for 2 years. Okay. And I did get into a couple games and we were up by about 5 goals.
Okay. That's 2.5 goals a game. That's not too bad.
Yeah.
We'll include high school and before. Were you the type of, now that you're a goalie, this takes on a whole new answer. Did you ever get a red card?
I did not get a red card that I can remember. I've definitely have gotten a few yellow cards.
Make it known that Andrew was a clean goalie. No accidental elbows to the face coming out to catch cross.
I can't say that didn't happen, but it was definitely I never got a red card.
Never got caught.
Just never got caught. Yeah, perfect. So, hey, Andrew, a big thing that I wanted to ask you about was your podcast that you do with Jerry Durham, Healthcare Disruption, it's phenomenal. I try to listen to it every day when I'm out on a walk. For lunch, I'll try to pop on an episode or two. And I know in the last few episodes, you've spent a lot of time talking about the customer experience and how that relates to PT just as much as anything else, and how it is really a good barometer of success within your practice. Maybe you can share with us some of your insight on why is it that maybe a PT provider feels more like just that, a healthcare provider, like it's a product and not a customer service. Someone that's really involved makes a one-on-one relationship.
I think that's a really good question. And the two I don't think are necessarily mutually exclusive. You can be by definition, physical therapy, we are a healthcare provider, but that doesn't mean we can't be customer service providers. Customer service has to be part of delivery of healthcare. And I think for a long time, from a traditional medical model, that eventually sort of fell by the wayside as there was a large discrepancy between, or how medical providers were viewed as being so knowledgeable way up here, and the people, that knowledge gap has now really become a lot closer. And still, physicians especially are sort of more revered than other healthcare providers. But because of that, I think customer service kind of went by the wayside, because the attitude may have been that I'm the expert, I know what I'm doing, these people can wait until I am able to give them my knowledge and give them my care. But nowadays, especially as we're seeing the cost shifting from insurance companies to the consumer, so to speak, people are starting to become a little bit more savvy consumers of healthcare. And now they're going to, apologize for my ADT alarm going off in the back. I think people are now starting to realize that if I'm choosing between provider A and provider B, and essentially, especially in the insurance-based healthcare, the cost difference is there is none. I can now choose a provider based on multiple factors, and one of those is going to be the customer experience and a quality customer service. So that more and more is starting to become a much more important thing than I think we've seen 10 years ago.
And do you think that mindset of really providing the best, customer service and understanding that patient experience really not only has a huge play into the results of that patient, but it reflects you and your practice. Is that something that you always felt and that PT would be when you became a PT, or is it something more that you've developed, through experience and watching the healthcare field change?
Yeah, definitely the latter. I mean, it's definitely something that I have sort of come to realize, really, especially in the past 3 years. Prior to that, so much of my focus was enhancing my clinical skill that the customer service angle of things really didn't even come onto my radar. And I wasn't in the working situations I was in, that was not even emphasized. I worked in for a physician-owned group for my first job out of PT school. I worked for 2 corporate groups, and eventually I worked for the private practice that I'm in now. And between especially the physician-owned group and the 2 corporate groups, the customer service was really just given lip service. There really wasn't a plan in place in terms of instituting a good customer experience type policy to the employees. So it was really something I sort of discovered organically, and then really kind of started hitting home with really being introduced to Jerry through Twitter, and then eventually attending his seminars and then a couple courses, and then just regular contact with him. That was really sort of gotten my wheels churning about that aspect of what we do.
Well, I mean, certainly they're inspiring podcasts, and the way that you talk about it, really, it shows that you mean what you say and that you provide a great experience for your patients, and you share that along with Jerry. But let me ask you one more question then as a follow-up. Do you think that, maybe a new PT or really a new grad from any program within the healthcare world would benefit from a course maybe in contemporary healthcare, the way that it's moving, and how to maximize that patient experience?
Yeah, 100%, because that's the direction that especially physical therapy is going to be going. And we know that there is some couple good research articles out that show that what patients care about, and what they care about is empathy, is having a good experience, having someone who listens. And so those kinds of things all impact the total, not even just the clinical outcome, as well as the clinical experience. So if you neglect that piece of it, that may have a negligible effect on your overall outcome. So learning that is going to be huge. And because it's not emphasized in PT school, it's not usually emphasized in continuing education courses, that may put you farther out ahead of your peers and ahead of your colleagues in terms of the outcomes that you're able to provide and the experience that you're able to provide for your patients.
Andrew, just to change gears here and kind of put a different perspective on it, I don't want to make it corporate versus private or insurance-based versus cash-based practice. I kind of want to give you a case study here, and you can just take it as you will, but I'm your neighbor down the street with knee pain. Why is it important for me to get that customer service from you over somebody else? What's that do for me, and how's that help my pain and my problem?
Well, that's a really good question, because it's not about getting the customer service per se. It's that the customer service is wrapped in with the entire treatment experience. So the customer experience begins with your first contact with me. If I'm the provider, if I'm the person you're asking me for a reason. So even though I may be your neighbor, I'm a physical therapist, that might be reason enough for you. But if you think that I don't know anything, there's no point in you asking me to begin with. So I think the fact that you would ask already says, well, maybe he might know something about what I can do for my knee pain. So that initial interaction that we have is already getting the ball rolling with your experience, so to speak, in a healthcare environment. So now I'm saying, well, I have to be able to demonstrate that I can understand what's going on with you, that I can figure out what's going on with your pain, what the driver is, and then how to treat it, and then give you a good explanation of this is what I think it is. This is how long it's going to take. And this is what your expectation can be. Once I find out what your expectations are in terms of an outcome, that already is part of the whole treatment experience. Now, the next piece of it is actually if you're going to come into the clinic, then that pulls into what's your interaction with the front desk, what's your interaction with the staff, what does the clinic look like? Those are all things go into the customer experience for the full package deal, and that's sometimes a different conversation. But I think once you establish yourself as an expert and able to answer the questions, put the patient at ease, give them confidence in you, start that therapeutic alliance and build that buy-in, that's such a huge chunk. That's, you can't put a price on that.
Well, and that kind of, it's a good way to put it. You can't put a price on it, but you found a way to do that. You certainly have. And I think that's pretty unique in that a lot of us healthcare providers, but really just anyone delivering a service, it's not like the iPhone or the car that you have to sell that's just got a sticker on it. It's a different ballgame when you're talking about service. And I'm wondering, because it's so intricately involved with communication, effective communication, what type of barriers do you typically see? Or what are the more common barriers to just living a healthy lifestyle that you find you often have to correct with your clients? What are the most common things that people might not be aware of that you got to say to them, you got to stop doing this, and this is why?
Yeah, that's tough because you run into a variety of barriers depending on what kind of patients you're dealing with. And I'm fortunate that I'm able to work with a wide variety of patients, from young to old to athletes to non-athletes and everything in between. So we're seeing a little bit of everything. And the barriers that we encounter are pretty much the barriers that are the big issues plaguing our country today from a health standpoint. Obesity, lack of activity, lack of physical exercise, lack of awareness of nutrition, stress, sleep, lack of sleep really. And all those, especially when we're dealing with persistent pain, all those factors play such a big role. The biggest one that I seem to run into probably is stress, whether it's not even physical stress, but emotional, psychosocial stress, work stress, life stress. And that's pretty much the biggest one. And that's the one I find almost easier to address in a way versus nutrition. Sleep is, you can talk about sleep. It's, there's not that many people interested. People know those things like smoking. People know they need to sleep more. It's not like it's a mystery. But the nutrition conversation I have as well, but it seems to be the stress one seems to be the one that I run into the most. And it's a conversation I'm not uncomfortable having, but it's one that there's not easy answers for either. But I think people are kind of sometimes happy to have that conversation, happy to have someone listen. And I'm not necessarily judging or saying do this or don't do this. It's more listening and trying to, this is when you have those, the conversations of different strategies of how to lead them without telling them in a way. Because it's one of those things that you tell someone to do something, they don't have to, it's very hard for them to get a change in behavior unless they internalize it themselves. So that you almost have to have them come to that realization, which is something I'm still working on getting better at.
Sure. Yeah. Well, I think you break a really great point about something that, maybe isn't addressed in healthcare graduate programs, whatever we want to say, in terms of that language and how we talk to people, and how important just listening is at times. And oftentimes people it will take them a little while to tell you what's really going on.
Yeah.
And it sounds like you've developed this, but I was just going to ask, one, how important do you find emotional intelligence to be for you in your field? It sounds like it's playing a role, but how has that developed for you personally? And then can you teach someone emotional intelligence?
Yeah, that's a word. The word I was looking for earlier was actually emotional intelligence. And then also along with motivational interviewing is like the style. But emotional intelligence, I think, is very important, especially when you're dealing with people. I mean, I was going to say something earlier about the nice thing about our field is that, as technology improves, other healthcare delivery systems are going to improve with technology. We don't have to worry about that because the person-to-person interaction is never going to change. We're not going to be replaced by a robot or a machine, Mm-hmm. So we're always going to have that person-to-person interaction, even if it's in this kind of medium over the internet or still one-on-one live. That kind of thing is always going to take place. Emotional intelligence, I think, some people have it naturally and are really just gifted with it. And I think some people have to work on it. And I think I'm an example of someone who's had to work on it. And I've spent a lot of time sort of with, personal development, reading a lot of personal development stuff, really having to work on myself. And that has improved sort of my emotional intelligence and my ability, I think, to interact with other people. Because I think, again, Jerry and I talked about on one of our podcasts, empathy being a big buzzword in entrepreneurship these days, healthcare these days. But it's one of those things that should be sort of implied already. It should be, if you're going into a healthcare field, you should have empathy. And that really means being able to kind of look at the situation from an outside point, outside of yourself in a way, look at the situation from the person across from you's point of view. So when someone's in pain and you're annoyed by that, isn't that a problem? Because you're there to help them. Why does this person keep coming back? They're always in pain. No shit.
Well, we just have to change to explicit content now. No.
Sorry.
I'm kidding.
Channeling my inner Jerry Durham.
I think I really appreciate that reflection, because I think for me personally, that's something that's really important is that aspect of personal development and really understanding yourself before you can truly help someone else in a way of understanding them and developing empathy. So I really appreciate your intake on that. With that, how important do you find language and allowing time for a response to play into your role as a PT? So, say for example, I'm in pain, but I don't really want to tell you I'm in pain because I'm a tough 29-year-old male and I don't ever want to admit to someone I'm in pain. How do you approach that? I think, and not just from a PT world, but as a healthcare professional, I think we're faced with that all the time. The person who doesn't want to tell us what's going on, and what kind of language strategies do you find helpful for you?
Yeah, I find it's tough. I mean, every situation is different. That's also another fun aspect of our practice, right? Is however often you see patients, every half hour, every hour, you're going to have somebody different sitting in front of you, and you have to kind of find a way to relate to them and figure out what you have in common, whether it's personal things or interests, whatever it is, and try to get the conversation geared toward that. Talking about sports, talking about movies, talking about whatever, something like that gets them to open up a little bit, let the guard down, have a normal conversation as you would as you're building a relationship, until they increase their level of comfort to talk about maybe more personal or sensitive things. With some people it takes 4 minutes, with some people it takes 2 weeks. It kind of just depends. I think the nice thing is that as physical therapists in general, we have a lot more time with our patients. Now, I've worked in practices where I had a 30-minute eval and a 15-minute follow-up, and that didn't work well at all for me. The practice I'm in now is an hour eval and a 30-minute follow-up, and that's pretty ideal. Sometimes longer is even better. But that gives you time where you don't feel, if you have a 30-minute eval with a persistent pain patient, I don't care how good you are, that's not going to go well, because you need to have time to build that relationship. You don't go on a first date for 30 minutes. Maybe some people do, but then they're more skilled than me.
Likely not going on the second one, that's for sure.
Yeah, maybe not. Or they're a lot less skilled, either way. But it's, having the time to build that relationship, build that rapport. I find I like to use comedy as a way to break the ice and make things, kind of set the tone as being a little bit easier, a little bit more open atmosphere kind of thing. Not so like I take my work serious, but I try not to be so serious all the time with the patients. So they're coming in, it's a sort of more enjoyable type situation. And I said that's one strategy that I've sort of developed, not even consciously, it just kind of happened. And I realized, for some people, it's just you gotta kind of, get a sense of the room and see what you can get away. Some people you can get away with some things, some people you can't. You gotta sometimes take a chance, and sometimes, you try and fail. Sometimes it works out, and you gotta kind of learn from your mistakes quickly and move on.
It's like you're at the Apollo every day.
Right, pretty much. It's like, really?
Yeah. Well, you're a people pleaser, and that's a big part of what a lot of the healthcare industry is moving towards. As far as PT is concerned, at least we're spending a lot more time one-on-one. At least we'd like to. We'd hope that we are. And I'm wondering if we go back and visit that case study earlier. I'm your neighbor with the bum knee. We've developed that rapport because you've demonstrated to me that you genuinely care, that you're willing to spend the time to establish communication and not just, here's what you do, this is how it's done. So how does the conversation in your clinic come up about how I reimburse you for the services that you can provide the same or maybe even a little better than the guy down the road?
Well, thankfully, I don't usually have to have that conversation because that conversation is handled from the very beginning when they call to make the initial, if they're calling to make an initial appointment, eventually we come around to that conversation. And usually the front desk will have that information, or they'll talk about what they're going to do in terms of getting that information and then getting back to the patient with that information. In terms of, we're going to find out what your insurance benefits are, and we'll get back to you before your appointment so you know what they're going to be, whether it's a co-payment, co-insurance, deductible, what have you, so you know sort of going in what you can expect to pay at the time of treatment. And what I did I took this from Jerry, is that Jerry talked about how that part of the conversation was happening often a lot later. The typical way a first call goes is that, hi, thank you for calling. Can I get your name, your insurance information, demographics, date of birth, where do you live, all that kind of stuff. And I started talking to our front desk about having a conversation earlier on, saying, talking about their symptoms. So you're having back pain, trying to get to that initial super objective. So what does that mean? I'm sorry, having back pain. And I understand how rough that can be. What kind of things are you unable to do? What kind of things are you looking for from physical therapy? So starting to present that value, sort of that solution finding mentality earlier on. And then after you sort of establish that a little bit, then you're getting your demographic information, and then having that talk about what the cost is. And we do a really good job of, I know our billing, we have a woman who sort of scrubs our billing. She does a really good job of getting stuff up front, getting the information up front. So we have very few issues billing down the road where there's surprises for a bill that comes as a shock a month or two later. So we've done a really good job of doing that. And that's not, I can't say that for every place I've worked, because I've had two places in particular I've worked where they were terrible at it. And it was always an issue of people calling back, complaining about a bill and saying, I love the care, I love my therapist, I'm not coming back again because I got this $200 bill that I don't know why. And part of that was the bill correct? Of course. However, it was not explained to them very well from the beginning, so their expectations were different, and now the bill came late and way after the plan of care was over, and now there's a discrepancy between putting something on the value and then a actual dollar number.
Okay, fair enough. I mean, that sounds like, if you explained it to me and I kind of could jive with the way that transaction would take place, it seems like it would be a pretty simple thing to apply to every single person. But across the board,
And that's an insurance base, you know, so it's different versus if it was a
Right.
cash-based scenario where you may have a fixed rate, and that's going to be a different conversation.
Okay. Do you see physical therapy or just the healthcare industry in general moving towards one paradigm or the other? Do you see a change like in the next 10 years?
I see that, you know, we're seeing that now where there are more and more, you know, out-of-network and cash-based clinics opening up. But I think by and large, that's still that's going to be the exception rather than the rule. I think by and large, the rule is still going to be insurance-based practice. And the reason being is that people are already paying for insurance. You know, very few people are going to say, I'm already paying for this. Why, you know, I'm happy to pay even more for something. Now, there are people who will, and there are plenty of people who will. I still don't think that's the majority of people. I think if you look at healthcare and the health status in this country, you know, how healthy are people in general? A large majority of people don't put a large value on health, or they think it should come in the form of a pill, or they should think it should come easy, or they think they shouldn't have to work very hard for it. And that's, you know, does sound kind of pessimistic, I understand, but I think that's the reality. I mean, that's what we're trying to change, but that is the current reality. And, you know, there was a study that came out that with a pill form of chemotherapy, and it had a 60% adherence for a oral pill chemotherapy. A life-saving drug had 60% adherence. You know, our home exercise programs, are people with 60% adherence to their home exercise programs? Good God, I hope I can get that good. You know?
Of course.
So I think that I'm kind of meandering on this question here, but I think that there is definitely a segment of the population who values their health and are willing to pay money for it. You know, my daughter had to get tubes in her ears several years ago, and we had a percentage we had to pay. It was still, you know, a couple, you know, $1,500, $2,000, something like that was our part that we had to pay. And thankfully, we're in a situation where I don't have to decide between paying that or keeping my lights on. You know, I say, that sucks that I have to pay that, but I'm going to pay it. Although, especially when I was living in Memphis for a couple of years, we ran into a lot of people who paying $35 was, you know, for a copay, which isn't that high these days, paying that twice a week, you know, so 8 times a month, whatever that is, that meant that they couldn't maybe keep their electricity on, you know, in some situations. Thankfully, that wasn't the norm either, but that does happen a lot in certain parts of the country and in certain, you know, areas. So I think that a majority of people, no matter what, are still going to be using their insurance. I think more and more people will start to use maybe some cash. I think on the upside, to a certain degree, as the cost is still continues to be shifted from insurance companies to the consumer, if they realize that they still have to pay cash because of their deductible being so high anyway, that they might as well go down the street to a cash-based practice when they're going to get more one-on-one time and a better quality of care, you might see that change a little bit more.
I think you paint a really clear picture about how insurance is biasing both the minds of the consumer, right, the patient, and also, you know, the practicing clinician. Given everything that we've talked about prior to this about, and this is really only a conversation that I think for physical therapy minded people could really talk about how to make what some people call, you know, PT, pain and torture, like a healthcare, like this is a warming place. We want to heal you. We really want to provide a great service for you. You know, all of that has a value that sometimes I think isn't quantified, right? And maybe to follow up on Nick's question, that the practice itself might not move from an insurance-backed model to a cash or pay-for-service, fee-for-service model. But do you think a person that comes into your clinic now fully understands the value of their hour for an eval or a half hour, given the way it is now?
I think most people have zero clue how much financial responsibility that they have, or what the actual cost is for a episode of care, much less a single evaluation or a follow-up. You know, I think the insurance industry has done a really good job of making things so complicated that it's so confusing, purposefully so, because confusion causes, confusion, and it just kind of builds on itself. That they have no idea, and they just kind of defer to the healthcare providers to kind of try to make sense of it, which we're not experts at either. And that's why we have special people. You need a PhD and to kind of understand insurance policies, because everything is so different. And that's by design, because the insurance companies are in business for one thing, and that's to make money for themselves and money for their shareholders. They don't make, it's kind of like casinos in Vegas. They don't build those big casinos because everybody wins,
Right.
They make money by not having to pay for shit.
Shoot, I should probably cancel that trip to Vegas now then, huh?
Yeah, right. I thought I had pretty good odds. I think you're exactly right in what you're saying, that that an insurance would, pay for these procedures like a surgical intervention or imaging or anything like this. So maybe wrapping PT into that realm just doesn't meld very well. PT does have this more personal component, more patient to therapist time than, almost any other, healthcare chain, if you're seeing your physician or surgeon, certainly. So I guess the question I'm getting at is, maybe in the future, would the patient seek out, oh man, I think I've just lost my train of thought on this one, guys. We might have to do a little bit of editing. But in the future, if PT was seen as a preventative measure, it had a better component to it it's not just rehab. It's not just you hurt yourself, let's put us into that healing machine. It's something that could be part of your lifestyle. So maybe you would consider it as I can pay a little bit for this now instead of paying a lot more for it later.
No, I think that's a good question. I think, there is definitely a movement you're seeing of people going towards sort of the wellness sector of care. And something we're trying to do in our practice is have, we're insurance based, and I like being insurance based because I think it allows me to see a wider variety of people, but having some cash based, revenue streams coming in. One of those being preventative medicine is another big one that people are trying to push, because what's the expression? An ounce of prevention is better than a pound of cure. And again, it's part of that has to do with really good communication, getting the message out there to the public, educating the community. I mean, those kinds of things have to happen first to get people in the door to kind of seek that out. Because again, having people wanting to seek that out is going to be challenging enough, because the people's view of physical therapy is still rehab. People still don't fully understand what it is that we do, right? That's kind of what we've been complaining about for 10 years, that people don't understand what we do because we haven't been so good at explaining it to them or demonstrating it to them. Chiropractors are kicking our ass when it comes to marketing and being very clear. People think spine, people think chiropractor, for better or for worse. So I think that's I think that's the way the profession would like to go. I think that's part of what the whole APTA change to the movement system emphasis is all about, is making that transition. I'm thinking that is going to be a good thing. And I think that transition will happen. I think that will take time, though. I mean, all these things tend to take more time than we realize.
Well, Andrew, I think you've provided us with an incredible amount of content, and we can't thank you enough. We want to be respectful of your time. But I wanted to say, before we let you go, I want to ask just a quick question, maybe a quick recommendation for a book that somebody out there is looking for personal development that's personally helped you. And then where can people find out more about you and the work that you're doing?
There's a lot of good books out there. It's tough to narrow down. I think Start With Why is sort of that classic book. It's not just, it kind of goes personal and, more of a business type thing. I really liked the book Mastery by Robert Greene.
Okay.
And I also liked A Complaint-Free World by Will Bowen.
Huh.
He had one of those purple bracelets, kind of moving back and forth, 21-day challenge for not complaining. He's a minister. I can't remember where, maybe North Carolina. And it's not a religious book of any kind, but it references Maya Angelou. And it was just sort of, gives you perspective on, complaining, gossiping, all those kinds of things. And it was actually one I probably need to reread again, but those are the recommendations I would have. As for me, you can find me on Twitter at a Rothschild PT. Also, that's my Instagram handle. And I blog occasionally, not as frequently as I used to, on the manual for Urson on themanualtherapist.com. Other things have come up that I'm not doing that quite as frequently. And then, of course, the podcast with Jerry Durham, Healthcare Disruption, where we trying to release new podcast twice a month or every 2 weeks.
Which is great.
Yeah.
Appreciate that.
Highly recommended that if you're out there and you're curious, not even just for physical therapists, but curious about customer service, about building the experience for people. It is definitely worth your time. And we will put all the links to that in the show notes. So we'll put Andrew's Twitter handle, Instagram tag, Facebook, you name it. We will put it on in the show notes. If you're on Twitter and you're in the physical therapy world, you definitely have seen Andrew. He is nonstop, shows up everywhere. He's so helpful. We met up with Andrew through Twitter. So it's amazing what you can do just through these social mediums that are out there. And yeah, thank you guys so much for listening to this episode of Two Nobodies Talking Podcast. Check us out at www.twonobodies.com. Nick, Eric, anything else?
No, thanks, Andrew. Everything that you said tonight was great. I really appreciate it.
Well, thanks, guys. Great line of questioning. I appreciate it as well. Thanks for having me on.
Hey, of course. All right, guys. We hope you have an incredible day, evening, morning, wherever you're listening from. Thank you again for listening. We are always looking for a healthier, more positive world.
Thank you.